Hey everyone, welcome to today's episode of the Chiro Couch. My name's Dr. Andrew. I hope you're having a great Friday. Now on the Chiro Couch today, we're going to talk about tailbone injuries, and specifically, if you've ever fallen on your tailbone, you may have injured your coccyx with force that it causes it to be painful when you sit down or even lay down on it. Well, I've actually fractured my tailbone when I was snowboarding and I was at university, and the pain was excruciating and the treatment was actually difficult. But regardless of whether the tailbone is fractured or injured, usually the treatment is normally the same. You see, most tailbone injuries occur from falling on an area and causing a bruise or a dislocation to that area of the coccyx. Now, the coccyx there has lots of nerves, as you can see closely to it there. So falling on it being the most common cause of tailbone injury can result in difficulties sitting, might have problems when you're pregnant or giving childbirth. You might have referred pain from the back down into the glute area, or you might have difficulty doing things like cycling or rowing. Now, when you injure your tailbone, you might experience inflammation or irritation that can cause that discomfort. So if they're inflamed, or if they're causing tightness within the ligaments, it might cause a misalignment and compression of nerves. There's lots of nerves in this area, as you can see just down the bottom there. Now, of course, if it's painful like that, we want you to put ice on that area to decrease the amount of inflammation that you have. Now, if you experience trauma like this and it's moved out of our area causing pressure on the nerves, we may be able to correct the misalignment and relieve some of the pain that you have. You see, there are several exercises and stretches that we can get you to do to aid the recovery of this type of injury. But chiropractors are also well known by not just doing these exercises, but reducing the pain by adjusting those muscles, tendons, and ligaments surrounding that tailbone. We also look at strengthening certain areas as well. Now, here in the clinic, we're experts in musculoskeletal conditions. So the best thing for you to do if you're having coccyx pain is to get it checked to see what the problem is actually coming from. You see, in some cases, we may actually request an X-ray or an MRI to evaluate the severity of the injury. And it's really important to know the direction and the severity of that coccyx problem, because pushing it in the wrong direction might make it worse. Now, if you're unable to seek medical attention straight away, please avoid doing activity that could cause pain, and just rest and make sure you use that ice therapy as much as possible. It's a good idea to ice it 20 minutes every half an hour, 10 on, 10 off for a first half an hour, and then every 24 to 48 hours after, just keep putting ice on it, even if you don't feel like you need to. Sit on a cushion, you'll be the envy of all your friends walking around with a donut pillow. And of course, if you treat it properly, it could take around 3 to 4 weeks to heal if it's just a bruise, or if it's fractured, it could take between 8 and 12 weeks to fully heal. It will take longer if you don't receive complementary care. So during this time, it's vital to make sure that you don't do any other damage to the area. Take a break from doing heavy activities, cycling, all those sorts of things, because you might just re-injure it. And of course, if you think you have a misaligned or fractured tailbone, give the office a call and I'll let you know whether you do. So I hope that helps you with tailbone injuries. Please don't ignore them. We like them to heal as quickly and as best as possible so you don't have further problems in the future. My name's Dr. Andrew from Rabina Chiro Wellness Centre, and I'll see you all next week. Bye for now.